Speak with Ballad Health's infection prevention director. This is Jamie Swift, someone we've turned to a lot over the past few months, and she's joining us live via Skype. Jamie, thanks so much for your time. Good to see you again.
Thanks for having me.
We're hearing about hospitalizations increasing across the country. Tell us about hospitalizations in the Ballad Health Network. How many people are you treating in your facilities tonight for COVID-19?
We have 6 patients that are hospitalized, and that is an increase for us. We have gotten to where we had a few days with 0 patients hospitalized and then just a couple. So to have 6 in-house again, we are certainly seeing that increase.
Ballad Health put out a notification this week that there's growing concern about travel, that a lot of the people you are seeing with COVID-19 had travel in their past few weeks. Help us understand what you think needs to be known by anybody who's trying to take a vacation right now when it comes to COVID-19.
That trend is still continuing. Certainly the cases we worked today, we saw a lot of travel-related cases. I think I just want to encourage people to weigh the risk. You know, is that vacation really worth it at this point in time? And if you still need to travel, if your answer is yes to that, then, you know, we ask that you do that safely. I would start really trying to plan ahead, think about how you can socially distance, have your mask. I would really avoid restaurants that are not practicing the prevention measures, limiting any exposure, and try to just keep to yourself as much as you can.
Back to the hospitalizations issue. I mean, 6 people, that's an increase, but that's a very small percentage of the number of people in Ballad Health hospitals tonight getting care. Is there concern, as there was at the beginning of the pandemic, that that number could go up? And how real is and present is that concern tonight?
And there is, and so what we're seeing kind of here and across the nation is right now the increase in cases seems to be in the younger age group, and so we're seeing cases go up and not as quickly the hospitalization rate. And what we fear is that, you know, we have this younger crowd that's out and about, maybe not practicing social distancing as much as they should. Fear is, as these people are positive, returning home around their friends and family that are more at risk, then 3 to 4 weeks from now, do we start to see a surge in hospitalizations? It's a very real threat that we're preparing for.
Let's talk about testing. There was an issue raised even by the president this week that maybe there was an increase in the case numbers because there continues to be an increase in testing. What do you think? Are we seeing locally an increase in testing potentially related to that sort of increase in number we've had lately, or is it there just more spread? What do you think?
Our testing rates are actually staying pretty steady in this region, so we're offering the same amount of tests that we have for several months. And I think that may have been the truth at the beginning of the pandemic. Certainly, you know, the best thing we can do in a pandemic response is continue to aggressively test, find those cases, make sure that we're contact tracing, isolating those contacts, and trying to prevent spread.
You know, I don't think when this all started, any of us ever thought that the CDC would be recommending that people wear face masks in public. And then I'm sure none of us thought it would become such a divisive issue. And you've tackled this head on and from the start, this issue that people really feel as if the face masks are an infringement on their rights. And being told to wear a mask is something they're just not going to do. I know you're a big advocate of it, but what would you just say to somebody who just really thinks that this is being overblown, that it's unnecessary and even an infringement on their rights?
I really am passionate about this topic, and it's not because I just want to be right or have it my way. There are more and more studies that are coming out that show that mask wearing is one of the best defenses we have right now. We don't have a lot. I don't have a lot of things to fight COVID with, but the one thing we do have to work in this region is to put a mask on. And, you know, if you're dead set and believe that it doesn't work, I challenge you to look at scientific research. There's more and more evidence that mask wearing certainly does impact the spread. And think about your friends, your family, your neighbors, those people that we desperately need to prevent this spread to, and just put yourself in that place. And it's a small sacrifice, in my opinion, to put a mask on. Maybe be a little uncomfortable. There's all sorts of varieties and styles. You can certainly find what style works for you, and just work as a community to try to slow this down.
You know, there was hope that this would be a seasonal virus, like the influenza virus, that when summer came that we'd see a drop. Are you seeing any indication at all that the warm temperatures, that the summer months is going to help us all with COVID-19?
You know, there's a lot we don't know about this disease. It's a novel strain of the coronavirus, so certainly we're not sure, but every indication right now, and based on how it's spreading and where it's spreading, is that we're not necessarily going to get that reprieve just because the temperature goes up.
We've not seen it yet, at least locally. You know, I think a lot of people are saying, I am so done with this, Jamie Swift. I want this pandemic over. I'm done with 2020 for a couple of reasons, but the pandemic's the big one. What do you think it's going to take for us to get to the point that we could really, truly say the pandemic is over, coronavirus is part of our story, but is a part of our past?
You know, I think to ultimately get to that stage, it's going to take the vaccine, and it's going to take a high percentage of the population taking the vaccine. Until we get that, because we know that's several months, if not a year down the road, until we get that, the only thing we can do is for the public to implement the measures that the scientists are recommending. So the social distancing, the mask wearing, the still not going out and about just to go out and about, you know, still trying to make those essential trips. We can certainly keep the economy open, but do it with the protective measures in place.
Jamie Swift is Director of Infectious Prevention at Ballot Health and an advocate of face masks. You're not ashamed of that, are you? Have you gotten into it with somebody? I'm sure on Facebook you've been dealing with it, right?
I try not to. I try not to engage in debate. My goal is to educate and inform and really just try to win people over.
Sounds like a smart tactic, Jamie. It's good to see you again. Thank you for your time.